Hi everyone and welcome back to the channel. My name's Louise and I make videos all about my life living with scoliosis. I'm now 13 years post my spinal fusion surgery for my scoliosis, so I thought I would do a video to talk about how I'm doing now, how things are with my back, and answer some of your questions as well. I asked my followers on Instagram and TikTok for some questions of what you would like to know about my life now, 13 years post spinal fusion surgery, and I got quite a lot of questions, so I've picked some of my favourites and let's jump in and answer them now. The first question is, how's life with a fused spine 13 years on? To answer this question, I'd say that overall my life is pretty good. I do get back pain, I do get stiffness, and of course I can't bend my back because my spine is fused, but none of these things stop me from doing anything that I want to do day to day. So I live, I'd say, a relatively normal life. I work full time, I do a lot of sports, I do a lot of running and hiking and things like that. So even though I get pain, it doesn't stop me from doing what I want to do. This leads me nicely on to the next question, which is, do you still experience pain? And what is the level of pain? The answer to this is yes, I still experience pain. But for me personally, I don't get the same amount of pain that I had before I had the surgery, and the type of pain I have now is different. So before I had the surgery, because I had quite a severe scoliosis curve, I experienced quite bad muscle spasms and they were very, very painful, and nothing I did would ever get rid of them. And since I had the surgery, those muscle spasms don't tend to happen now, but I do get more lower back pain, and it tends to be more of an ache, and it tends to be when I've been on my feet for a long time, if I've been in one position for a long time, whether that's sitting down, standing up, walking around. But if I'm on my feet for an extended amount of time, then my lower back will start to ache, or if I'm doing things like cleaning or any activities where I need to be bending down and picking stuff up, that's when I start to get backache. So things like gardening or cleaning and things like that I do struggle with. But generally on a day-to-day, the pain doesn't stop me from doing anything, and normally once I stop the activity that I've been doing to aggravate my back, whether that's standing up for a long time, you know, as soon as I switch activities and sit down, then the pain will subside. So it doesn't stop me from doing anything. I'd say on a scale of 1 to 10, I'd probably say it's around a 4. I don't take any painkillers at the moment. I have done in the past, and I did when I was first recovering from the surgery. I feel very lucky that I don't need to take painkillers. I do now and again if it's flaring up, if it's a bad pain day, but generally I don't need to. I also find that around the time of the month as well, the back pain gets more severe, and then I do need to take some ibuprofen for that. But I'd say day to day, I don't really have severe back pain. That being said, pain is very subjective, and it could be that I have got used to it over the years, and so I don't feel like I need to take any painkillers. But obviously every case of scoliosis is different. Some people experience severe pain and other people don't have as much pain, so everybody's individual experience is different. If you're interested in hearing more about an average week in my life and what the pain is like, I do have another video that I did about a year ago where I filmed an average week and rated my pain each day, so that should give you a good idea of what it's like day to day. Next question is there anything that you can't do that you could do before your op? To be honest, there's not a lot of things that I can't do that I could do before my op. In fact, I've done a lot of things since my op that I never thought I could ever do, and I never even attempted before my op. So things like running a marathon, things like trekking on the Great Wall of China. I've done some crazy things that I never thought I'd be able to do. That being said, I obviously can't bend my back, so that's probably the main thing that I can't do that I could do before my op. So any activities that involve bending my spine, so probably things like gymnastics, some type of dance that involves being bendy, limbo, things like that. But to be honest, because I've never done those type of activities anyway, I have no need to do them, so I don't really miss those sort of things. Also, as well, in terms of activities that involve bending, so when you have to bend down to pick something up off the floor or tie your shoelaces or things like that, you learn how to adapt, so you have your own technique and ways of doing things. So even though it might not be how you did it before, you have your own way, your new way, and then you quickly get used to it and you can't really remember what it was like before. I think the only thing that my surgeon said that I couldn't do post-scoliosis surgery was bungee jumping, because obviously that puts a lot of pressure on the spine. So I think that was the only thing he said. Obviously you do change how you do things, you adapt, but it hasn't stopped me from doing anything that I want to do. Next question is, can you still play sports? The answer to that is yes, you can still play sports post-scoliosis surgery, although you should not play sports in the year following your scoliosis surgery, because it takes about a year for the spine to fuse. So during that time there would be no bending, lifting, twisting, no contact sports, anything like that that could damage the spine. Once somebody has recovered completely from scoliosis surgery and had the all clear from their surgeon, then there's no reason why they can't go back to playing sports. Since my scoliosis surgery, I have done quite a lot of running. I didn't start running until about 5 years post-op, but I now run quite regularly. I've done a lot of hiking, and I enjoy doing hiking and going up mountains and long hikes. I do cycling and I've been to the gym. I don't go as much now, but you do have to be mindful of how you do certain activities. So activities with weights and things like that would be worth getting somebody to help with how you hold yourself, just to make sure that you're not putting your spine under pressure or at risk of damaging yourself. But there's no reason why you can't do sports and pretty much most things that people do post scoliosis surgery. And in fact, if you have scoliosis, then exercise is crucial. It's really, really important to keep yourself as fit and active and as strong as possible, because strong muscles will help to support the spine and reduce pain and other problems that you may get later in life. The next question is, what was the recovery like and how long? This could be a whole video in itself, but the short answer is the recovery is long. I had my surgery 13 years ago now. I was in my early 20s, which is slightly older than a lot of people have this surgery. I know a lot of people do tend to have the surgery as teenagers, so just bear this in mind when I talk about my experiences, because obviously I was older and everybody's experiences of scoliosis surgery and recovery are different. But for me, I would say it took me around about a year to recover, although even after a year I was still very stiff. I still had a lot of weaknesses in my muscles because I hadn't been as active as normal. So it took me quite a long time to build back up to where I was before the surgery. I would probably say a year to 2 years to start feeling like myself again and getting used to having a fused spine. First few months are definitely the hardest in terms of pain and movement and being able to do day-to-day things that people take for granted. So things like getting out of bed and having a shower and sitting on a chair, all of these things are quite challenging. And I was quite lucky that I had my mum to look after me because I was living at home at the time. And I would say it's really important to have that support network, to have somebody to help you in those early stages of recovery. But you do get stronger as days and weeks pass, and I would say after 6 to 8 months or so you start to notice improvements. And I was starting to be a bit more active after this time, doing physio, going on walks every day, but it does take time to build up. So if you're going through your recovery at the moment and you're at this kind of stage, it is a very difficult time, but things definitely improve and you will look back and think, wow, I have made it such a long way. It is a long recovery and it might not feel like it at the moment. Next, I had a couple of questions about nerve damage. Can we ever feel our backs again? Does the nerve damage get any better? In my case, no, I still can't feel most of my back. Most of my back is completely numb, and it's been like that since the surgery. So I think after 13 years, I don't think it's going to improve. There is obviously a risk of nerve damage with this kind of surgery, because obviously they're cutting through lots of nerves and muscles to get to the spine, obviously dealing with nerves around the spine. It is a risk and quite common in scoliosis surgery to have numb patches post-surgery. Sometimes these will go away and sometimes they might be permanent. So like for me, my back is mostly numb. Doesn't really affect me though, day to day. I don't really think about it, but when someone touches it, it feels a bit weird. So for that reason, I don't tend to go to have a massage or anything like that, because it just feels weird. I did have a numb patch on my thigh after surgery, like straight after surgery, but after a few weeks that went away. Now I do have a numb back, I do have numbness in one of my legs and a numb patch on my stomach. I don't know if they're all connected to my scoliosis. My back definitely is. It is a common side effect of scoliosis and a common side effect of the surgery as well. In terms of nerve pain, like the burning pain that you can get with nerve damage, that is a lot better now than it was post-surgery. I don't really get that as much. Sometimes I get nerve sensations like burning pain between my shoulder blades. I still get that now and again. I think when I've done too much. It doesn't happen that often. That was a lot worse straight after surgery. Next question is, what are the advantages for you of having spinal fusion versus the disadvantages? This is quite a big question and again could probably have its own video, but for a succinct reply, I would say the main advantage for me is that I no longer have to worry about progression. The main reason I had the surgery was because my curve was over 80 degrees and I was scared about progression in the future. So for me, the main advantage of the surgery is that progression is no longer a concern. My spine is fused, so it can't progress. In terms of disadvantages, I suppose the main one is that I can't bend my spine anymore. But as I said earlier, I've learned how to adapt. Also, one of my concerns is in the future about the wear and tear on my lower discs, because I'm fused to L3, which means that I have 3 discs remaining at the bottom of my spine that are not fused. So this means that those 3 discs take the weight of the whole spine. They are at risk of wearing out quicker than the average person. So this is obviously a concern and it's obviously a disadvantage of scoliosis surgery. However, I feel like for me, because my scoliosis was so severe, the risks around leaving it and not treating it and letting it progress and the consequences of that would be worse than having my lower discs wear out slightly quicker than the average person. So that's something that I'm likely going to have to deal with when it arises, but I think it's something that I would rather deal with than having my severe scoliosis progress and then potentially impacting my health. So this is an interesting question. Any advice on not looking back and being confident in the decision made? This is a really difficult one. I would say things get easier as time goes on. I think that straight after surgery, when you're going through the early stages of recovery, you've got a lot of pain and stiffness and you start questioning things. I'd say that's completely normal. That happened to me as well. I did go through a period of time where I regretted having the surgery and I wasn't happy with the outcome of my surgery, and I went through a period of depression and grief following my scoliosis surgery, and I think that it's something that's not very commonly talked about, but it is quite common. So I would say it's normal to have regrets at early stages of recovery, and for me that improved as time went on, as I became more active, as I got my strength back and I was able to do more things, and I didn't have the fear of progression hanging over me anymore, and that's a big thing for me, and I think that's something to focus on. The fact that if you've had the surgery and you may be feeling like you're regretting it, then maybe focusing on the positives, focusing on the fact that now the scoliosis can't progress, whereas if you didn't have the surgery, then potentially it would have done. So focus on the positives and all the things that you will be able to do once you've fully recovered. I do think it's difficult though, because as is often the case with scoliosis surgery, the decision whether to have the surgery is often left with the patient, which I think makes it really, really hard, because you feel like it's your choice and you're not being told you 100% need to have this, it's life or death. So in my case, I was told this surgery is available, it will help to stop progression in the future, but it's your choice whether to have it. So obviously it's a very difficult decision. It took me years to decide what to do, and at the end of the day, you can only make the decision that's right for you at that particular point in your life. And once you've made the decision, it's really important to move forward, focus on why you made that decision, focus on the positives and all the things you'll be able to do and get out of life once you've fully recovered from the surgery. The next question is, how do you carry bags? This is an interesting question. So in terms of carrying bags, if I need to carry a bag, then I will try to use a bag that distributes the weight evenly, so like a backpack. When I go out for hikes and things like that, I have a backpack that I bought specifically because it has a lot of support. It has straps that come around the front and around the chest so that it puts a lot of the weight on my hips rather than on my back. And that's really important. So in terms of bags for hiking and things like that, then it's definitely worth going to speak to a specialist, go to a specialist shop and get a bag that is as supportive as possible to avoid risking injury, which I've done before by having the wrong backpack. And in terms of day-to-day out shopping and things like that, I try not to carry too much. So if I have got bags, I'll try to even them out and have one on each side and kind of distribute the weight, and just try not to make bags too heavy. Try not to have a bag that goes on one shoulder because that causes a lot of pain. So I'll always have either a backpack or a bag that goes across my chest that doesn't put too much pressure on my back. Final question is, do you take supplements for joint health? The answer to this is yes, I do take supplements for my joints. I personally have no idea if they make a difference or if they do anything, but it helps me psychologically to know that I'm looking after my back in that way. So I take these at the moment. I don't take them every day. Sometimes I might forget, but these are essentially omega-3, vitamin D, and they've also got turmeric as well. Now, turmeric can be good for helping to reduce inflammation and back pain. Again, I have no idea if it works or if it does anything, but that's what it is known to be good for. Vitamin D, they have got vitamin D in these, but I also take another high strength vitamin D, and this is purely because I am low in vitamin D. So I have been to the doctors in the past and had a blood test, and my vitamin D levels were very, very low. So I was told by the doctors that I need to take vitamin D every day. Vitamin D is obviously good for the bones and the muscles, and so that's helpful. And then I also take vitamin B12. It can help with the nerves and the nervous system. Again, I don't know if it does anything, but I tend to take that. And that's pretty much it, to be honest. Like some days I might take magnesium. I've got these, but I've got lots of different ones that I try. But magnesiums can help with the teeth and the bones and muscles as well. But the main ones that I take are these joint care ones. I have, sometimes I just get the cod liver oil ones without the turmeric, but I just wanted to try the turmeric to see if it helps with reducing back pain. So that's the end of the Q&A. I really appreciate everyone who sent in questions. I found it really interesting reading through them and answering them. If you're watching this and you have any other questions that you'd like me to answer, then please put a comment below, or if you can relate to anything in this video, please also comment below. And if you're interested in hearing more about my life with scoliosis and my upcoming challenges, I am going to be trekking to Machu Picchu in October. So my next few videos are going to be about that challenge, about how I'm preparing, what things I'm taking, and then I'm going to be vlogging across the challenge as well. And this is all to raise money for the Scoliosis Association. If you're interested, I do have another video explaining more about that. But if you're interested in learning more about that, hearing more about my challenges and life with scoliosis, then please do subscribe because it really helps me out. Thank you so much for watching, and I'll see you in the next video.